Dear speakers, dear audience watching us on various channels, I say you good morning. You're all welcome to this online debate organized by the Geneva Press Club under the title COVID-19, How Do We Protect the Most Vulnerable Refugees? As far as I'm informed, there has not been a major COVID-19 outbreak in the refugees camps around the world at the moment. But the risk evidently is there. In many camps, the concentration of people is far higher than in New York City, and the living conditions are exposing these populations to a very high risk degree. Water shortage, no health system at all, and almost impossible to put in place a confinement. As some refugees claim, how can you stay home when you have no home? So the situation for all the displaced persons have already drastically changed, even if there has not been a major outbreak yet. We will have a discussion in four parts this noon. First, I would like you to sketch the today's situation in the camps. Second, we will discuss about solutions, if there are any, to control the situation. Third, I want to hear you about the funding of the aid. And fourth, I'd like to have your evaluation on the impact of the sanitarian crisis on the migrant flow in the longer run. And so thank you again for joining us. We are very lucky today to have a panel of experts and very high level personalities. So thanks again to all of you. I start the presentation with Mrs. Gillian Triggs. You are Assistant High Commissioner for Protection at the UNHCR. You are also the former chair of the Australian Human Rights Commission. Mrs. Caroline Abou-Sada, you are the director of SOS Méditerranée, an organization involved in rescue operations and research in the central Mediterranean. Then we have with us Gianluca Rocca. You are Chief of Mission based in Greece for the International Organization for Migration. So you're talking from Athens right now. And finally, Etienne Piguet, professor at the University of Neuchâtel, and he is also vice chairman of the Federal Commission for Migration. And Etienne Piguet is considered as one of the best Swiss experts on migration questions. So I suggest we start immediately, and my first question will be, in this first part about the situation of the refugees in the world, would be to Mrs. Triggs. And can you tell us what are the refugees hotspots today, and where COVID-19 had already a strong impact, and in what context do you put that?
Well, thank you very much. It's a great pleasure to be part of this discussion. And if I may, I'd like very briefly to just bring us, or put this in context of, we're coming into the 70th anniversary of the Refugee Convention with fundamental principles of the right of access to claim asylum and not to be returned to places of danger. We also had, just 2 years ago, an agreement by the international community to share the risks and burdens of refugees, asylum seekers, 41 million displaced people, and the many, many millions of those who are stateless. So it's in that environment, that legal environment, if you like, normative environment, that we are, that I'd like to answer your question, which is, where are the areas of greatest concern as a consequence of COVID? Well, of course, it's often observed that COVID is a health crisis, and it is, but it's also a major socioeconomic protection crisis, which profoundly discriminates against the most vulnerable people, including the people of concern to UNHCR. Now, where are those hotspots? Well, there are many, sadly. One that I think will be well understood is the Sahel area. And it's a combination of factors. COVID-19 comes as a sort of a global pandemic and emergency overlaying continuing emergencies and crises in the countries of the sub-Sahara. Partly climate change, conflicts over land and resources, poverty, fragile health systems. So we are very concerned about that area. Cox's Bazar, with nearly 1 million people from Myanmar, the Rohingya, now seeking protection across the Andaman Sea into Malaysia. Of course, Greece with overcrowded reception centres in the islands, and finally, and in particular, the North Central America, the large numbers who, approximately 5 million, who had left Venezuela for host countries such as Colombia. Some are now coming back into Venezuela, really adrift in orbit in a way, and very vulnerable in crowded environments, poverty, and fragile health systems.
Thank you very much for this short and global overview. Gianluca Rocca, so as I was saying, you are now actually in Greece, in Athens. You are the chief of mission for the International Organization for Migration there. So as Mrs. Triggs mentioned, you are really in a hotspot, at least in the Mediterranean area. Can you describe what is going on and give us a few figures about the situation today in Greece with these migrants coming in?
Yes, good morning to everybody. The situation has changed quite a bit. You know, if we start, we have to look back a few months ago, a few weeks ago, at the time of this crisis between the EU and Turkey, when we had large numbers of people that were trying to enter the EU. So since then, there was a strong reaction from the Greek authorities in trying to seal the borders. Then into that situation that already made difficult for people to cross the European borders from Turkey, we experienced the COVID situation. And I would say that the combination of these two elements have de facto brought the arrivals into Greece to very, very limited numbers. In April, we have practically 0 arrivals from Turkey. And you have to consider that from the beginning of the year, we have a total of around 7,000 people, migrants, that were coming into Greece. So we went...
In what time frame? 7,000?
Since January. So we went from an average of 2,000 per month to April with 0 arrivals. And you know, I think that, you know, certainly there is an impact of the fact that the Greek authorities have taken a very strong stand on the borders, but it's also the limitations that are posed by COVID-19 into travel and into moving also on the Turkish side. So this has left us with the situation that is the well-known situation on the islands, where we continue having around 40,000 people in camps that were designed to host 10,000 people. So in those conditions, it's not a COVID issue. Any type of virus will have the possibility to spread. So far, I think that we don't have cases recognized in the population in the islands. So we don't have in any of the overcrowded camps a situation with spread of COVID-19.
Go ahead.
On the islands, I would say that there is also an ongoing attempt to identify a group of people that are more vulnerable in relation to COVID-19. So elderly people, people with chronic diseases, and there is a movement that has started this week trying to bring these people into temporary accommodation in the mainland, so taking them out from the camps. The situation is a bit different in the mainland. In the mainland, you have a system where migrants are accommodated in apartments, in temporary accommodation in hotels, and in camps. So you have, in hotels, you have a population of about 6,000 migrants, and in different camps, in 30 camps throughout Greece, around 27,000 migrants. So in one of these hotels and in two more camps, we have experienced cases of COVID. These are facilities where IOM is working very closely with the government in the management. So that's why we know very well how the situation is developing.
Can you tell us how many cases of COVID-19 you have today in Greece, in this population, this precise population of refugees?
Around 200 cases. The largest group is 150 positive cases that were recognized inside a hotel facility. And they were recognized like 10 days ago, a week and a half ago. Interestingly enough, in both cases, in camps and in temporary accommodation in hotels, those that were found positive were asymptomatic. So they were not requiring any type of medical support. They were identified as asymptomatic because one pregnant lady, for obvious reasons, has to reach the hospital. And out of a regular testing, they realized that she's asymptomatic. And then they tested the whole facility and they found 150 cases. Now we are into...
Okay, so that means that you suspect there could be much more of this population, including in the islands, that could be positive if they were tested. Is there testing going on? Just this one more question. Is there testing going on in the islands, very shortly?
No, I think that the testing, the approach to the testing that is valid for all the Greek population and for the migrants is triggered by symptoms. So they're not proceeding with the testing, but this is valid for everybody, for the non-Greeks.
Okay, thank you very much. I turn myself, if I can say, to Caroline Aboussada. So you are the director of SOS Méditerranée. As I said, it's an organization that helps, that rescues refugee people on the sea, in the central Mediterranean Sea. What is the situation of the flows of refugees still coming in on the boats? Medias don't tell about it anymore, but it seems that there are still some dramas happening now in the sea.
Yeah, thank you. It's not that media are not reporting, it's just that there's a lack of assets, of search and rescue assets in the Mediterranean Sea. For example, we're in Marseille since a few weeks now. There were two humanitarian boats, the Alan Kurdi and the Aïta Marie, who took people on board and then had to disembark them on another boat to do the quarantine. There's no assets currently, so it means no asset to search and rescue and no asset to also testify on what's going on. So the testimony capacity somehow is also completely gone, at least on what's going on in the central Mediterranean Sea. We know that the situation in Libya is definitely not getting any better. The conflict is still ongoing. There are cases, at least we heard, there were confirmed cases of COVID-19. It's not like the health situation or the sanitary situation in Libya was any good before the pandemic started. So we can imagine that now it's only worse, and the weather is better than before, and we know it's one of the reasons of departures as well. So we know all the conditions are there to have a lot of departures, and we know there's no assets. So the only conclusion we can actually draw is that probably there's a lot of people missing. There's this testimony capacity that is gone as well, which means we don't have exact numbers of how many people are living, how many people are actually dead since a few weeks, and it's probably the worst case scenario at the moment in the central Mediterranean Sea.
And do you know how is the situation in Libya? Are refugees still coming from the southern African countries to Libya, or is the border closed? What was the situation there?
This, at least we don't know. What we know is that the people who were inside the detention centers in Libya are still inside the detention centers in Libya. And as Mr. Rocco said, the problem is not the COVID, the problem is the conditions within those detention centers. Any virus would actually be, like, I mean, it's not like we can respect the 2 meters distance in detention centers in Libya anyway. And the conditions are absolutely awful. I mean, we know from the testimonies of people that there's a torture going on, ill treatment, a lack of access to healthcare, and so on and so forth. So with or without the COVID, people are trapped in those centers and should be able to have access to any sort of medical care anyway.
Thank you. Before going to Monsieur Etienne Piguet, can I just turn myself towards Mrs. Triggs? Can you give us some more information about the situation in Libya? And secondly, do you know if there are still a lot of incoming inflatable boats coming into Italy or Lampedusa or Sicilia or whatever, wherever?
The position, as we understand it, is that the numbers are growing of boats coming in. Some are people smugglers are in fact trying to find other routes up through into the Canary Islands. It's very hard to get accurate information, partly for the reasons that Carolyn has explained, that there just aren't enough available boats out there engaged in research and in search and rescue. We would, of course, like to see a regional, but particularly EU response to this on a coherent joint way. But we are concerned that with the weather improving, we're very likely to see more boats, but also with the conflict continuing in Libya and the conditions, as Carolyn quite rightly outlined, being pretty dreadful conditions in detention, but as well as economic impacts of the fighting and other measures or circumstances, we're expecting to see, and we'll come to this later, I know, but expecting to see a greater push across the Mediterranean, and therefore the matter does need to be discussed and efforts made through the EU to reach joint approaches to disembarkation in safe ports.
Thank you very much. So you gave me the transition to the political situation today, and especially in the European countries. Mr. Piguet, on the European side, how would you describe the situation? Turkey has opened the borders with Greece. The countries of the European Union last September, I guess, were talking before the crisis of a large relocation program. And where are we today in the process of decision and of political admittance proceedings on the European level? Can you sketch us this, please?
Well, perhaps to start with an optimistic aspect, there has been in recent days some arrival of unaccompanied minors who have been rescued in the Greek islands. And this is a sign of hope, although the numbers are extremely small. But it shows that
we are talking about 10 cases for Switzerland, some 20 perhaps for Germany. So it's really very almost individual cases, right?
Yes, but it's the symbol of the fact that when people can agree, it is possible, despite the extremely difficult COVID situation in Europe, to save people. I mean, it is possible, but
okay.
That just to have a small optimistic message at the beginning. But overall, unfortunately, one cannot be very optimistic, because what can be said is that COVID has not really changed the paradigm. I mean, the situation is the same, but it has exacerbated tendencies which were already there. And of course, the most important is a tendency to closure, nationalistic egoism, and the possibility for populist groups to instrumentalize the issue of migration for their own political objectives. And this situation has not changed, and it's even easier now probably to argue that a strict closure of the border is necessary. So this is the situation now, and we are already for years and years in a situation where Europe has extraordinary difficulties to agree on a responsibility sharing scheme regarding people who are in need of protection. So that's why I'm not very optimistic regarding the new situation. But nevertheless, there is no other solution. I mean, the European asylum system has to be fundamentally reworked, and we have to work on that.
Thank you. Mrs. Triggs, we are talking about some optimistic news here. Another good news is that there was no outbreak for the moment, no big outbreak, at least in the camps. But in your plans at the UNHCR, I guess that you are looking forward what would happen in case of an outbreak. How would it look like if the COVID-19 spreads out like it did in the European countries, for example?
Well, that is the nightmare. All the indications, and I'm a layman, I'm not a medico, but as a matter of common sense, in these appalling conditions in camps, we are, of course, concerned about the vulnerability. So, of course, UNHCR, under our High Commissioner, we are getting in place plans to assist to the highest degree we possibly can, establishing isolation hospitals, making sure trained staff are in there, using all forms of technology to ensure that we're getting the message out about clean hands. If we take Africa, for example, the numbers of cases are in the thousands and growing. The numbers of deaths are mercifully very small, but they also have experience of Ebola. They're actually, many African countries are quite used to dealing with this. And that we see as a positive, because we're building on a relatively educated community in terms of managing some of these problems. But certainly that is something of enormous concern to us. Can I also point out, however, that of the 78, 79 million people of concern to UNHCR, most are actually living in urban areas. There are, of course, camps. Particularly Greece, we've seen some countries using immigration detention as an administrative measure arbitrarily. Conditions are appalling, and camps are not the way to go in the longer term. But nonetheless, about a third do stay in camps. But that's been the scenario that we've been most worried about. But we are now, of course, concerned about the overwhelming numbers that are still in urban or semi-urban areas where they've lost livelihood, where health systems are very fragile, and so on.
You have published a few days ago, I guess, a long list of recommendations to the countries, how to treat the refugee question in this COVID period. It's really a long list. I read it. It's pretty complicated in some ways. And do you think these countries are really able to apply those recommendations in the camps? Or is it a kind of wish list you have published?
Well, as you can imagine, of course, we want to put forward those things that we would like people to be able to achieve. But we know, of course, we have 400 field officers for UNHCR. We know how extraordinarily difficult it is. I mean, in some instances, we can't get our staff, either local staff or international staff, into the particularly isolated areas and camps. And there's another side to this, of course, and that is that camps aren't necessarily keen to see European humanitarian workers because they're seen as vectors. These are very complicated questions, but I think your key point, and that is one that troubles us more than anything, is that for us to talk about social distancing, hand washing, these are extremely difficult to achieve. However, the main initiative by UNHCR through our NGO groups and community groups is to get soap hygiene materials, to get special water facilities available, so that at least some of the basic healthcare precautions can be taken. But we're well aware, of course, of the practical difficulties of achieving this in the way that we would like to achieve it. But as I said a moment ago, there is a ray of light here, and that is that there is quite a high level amongst African nations of understanding of the importance of these measures, even though they're in extremely difficult circumstances in implementing them.
You are there on the field, you see how it's going on, how these measures are applied. Can you really make social distancing, have social distance, have hand washing in camps like we have in Lesbos or in other places? What's the reality there?
Yeah, I would say that, again, we have to look separately on the reality in the mainland, in the camps in the mainland, in the camps in the islands. The camps in the islands, for any type of activity, you have to solve the problem of overcrowding. Without overcrowding, you cannot achieve a lot of results, because in an overcrowded camp, access to water is limited, there are some fundamental issues. And I would say that the issue of having overcrowded camps in the islands is something that is very political, and is living with us for the past 2 years, and is linked also to the inability of Europe of deciding what do we want to do on the Greek islands. They are not Greek islands, but are the border of Europe. So I would rather say our direct experience share with you what we have in the camps here in the mainland, where, okay, this is Europe. So you had the reaction of the government, the Greek government, that set up a plan for COVID in the camps, with quarantine areas, quite a fairly good plan. The reality of the plans is always different from what you write the plan. So now we come on what the colleague from UNHCR was also mentioning. There are cultural issues. It was very difficult for us that we are in the camp there, and we have certain trust with the people there, to convince certain African communities to undergo the testing, because they don't believe in the testing. They don't feel they're sick. So there is a lot of skepticism. So there are things, the quarantine, they don't want to go on quarantine because they don't feel sick. So then you reach the point where, should you use the police to keep the people in quarantine? Or should you invest more into discussing, explaining, and proving that this is a measure that is useful for yourself, but also for all the people that are living with you? As IOM, we are taking this sort of approach, and we started even before the COVID spread in identify community leaders inside the camps. We identify a system for spreading the information timely, using WhatsApp, using simple methods.
So you are using the recommendations, for example, from the UNHCR. Are you following this?
Listen, being in a EU context, there are clear instructions that are developed by the Ministry of Health, like in all our countries in Europe. So they are very detailed on what to do when we have a case of COVID inside the camp. And basically there is also the Ministry of Health and other components, the Ministry of Civil Protection. They are coming in and taking the lead on those activities.
But excuse me, what do you say about those voices who say that some refugees in Greece are mistreated, that they are put in kind of quarantine as if they were put in jail to isolate them, especially the older people? What can you say to that?
No, to what I can witness in the camps, in the 32 camps in the mainland, this is not happening. There is not a system of segregating people on the opposite. You know, we have the problem being in the field to explain to the people that should restrain the movement by themselves, because they are free, I mean, relatively free to move, at least inside the camp. So we have to convince them to try to limit the contact with the other groups. So certainly we don't have experience of this type of situations. Certainly there is a reduced mobility. It's clear that if a camp is quarantined, people cannot go out and buy medicines or buy food or buy whatever they need. So this is what we are trying also to do, to try to bring the food and the medicines to them instead of them going to the city.
Okay, thank you. Carolina Busada, for sure it's almost ridiculous to talk about social distance on inflatable boats. This is no more a concern at this stage, I guess. But at the same time, for the rescuers, there is also a risk of this situation. Is your team still ready to go out with the boats? And you said before that the boats are, if I understand, blocked in the ports. What is going on? Can you go out? Can you help? What's the situation?
Yeah, it's a bit tricky because officially we're not blocked. I mean, if we were ready to sail today, officially we could do it. However, there's an issue of, there's three things that are currently missing. First is the possibility to evacuate medically anyone from a boat, because it's extremely complicated and even private companies are not ready to do so at the moment. The second one is the possibility to resupply boats at sea. The maritime world has been very hardly stricken by the crisis, so it's extremely difficult today to organize the resupply of a boat. And I'm not even talking about fuel, I'm more talking about water and food. And the third issue, and that's probably something on which we will have to be very vocal very quickly, is the closure of ports. So Malta and Italy have declared that their ports were closed because not a place of safety to disembark people. And that would be actually a joke if it was not that bad. Libya also declared that their ports were not safe to disembark people intercepted at sea. And it's a bit, the difficulty today is to balance the need for European and other countries to deal with the pandemic with the need to respect their legal obligations, because pandemic or no pandemic, I mean, they still have legal obligations to conduct search and rescue operations at sea and to help disembark people on their shores. So as much as we understand the difficulty, we're also extremely concerned about the situation. And where we've been calling mainly Italy and Malta to go for innovative ideas, either those quarantine boats or the possibility to disembark on shore and then have a medical structure straight after disembarkation so people can actually do the quarantine there. But we need to be a bit innovative and we need to do that very quickly because it's
When do you think you can? When do you think you can go back to the sea with your boat? Yeah, do you have an idea?
That's something we're assessing every single day because it's the situation is changing so much and so quickly that it's now that we've seen the two Aitamari and Alan Kurdi boats able to disembark on this ship that is not far from Palermo now for the quarantine. It has opened the door, definitely. Now the problem is also to ensure the safety of the staff. And as you mentioned, it's not exactly easy to ensure social distancing on a 69 meters long boat. So those are things to consider, and we are really hoping to sail back as soon as possible.
And your team is still somewhere ready to go out if needed, if they can.
At the moment, they're still on the boat, but in Marseille.
Okay. So you have actually one boat, or?
Yeah, no, we only have the Ocean Viking,
Okay.
and it's docked in Marseille at the moment.
Okay. Etienne Biguet, let's turn to Switzerland for a moment, if you want. In Switzerland, the procedure of asylum have been stopped for about a week or so, and then they started again, and with some special measures that were taken, like plexiglass for the reception and interrogation of the asylum seekers, and other measures. How? At the same time, I must say that many of the organizations for defending the asylum seekers have been very critical to the Swiss, saying you don't take the measure of the pandemic, you should stop everything. What's your take on that? Is Switzerland taking, you think, the right measures? Are the rights of the refugees still considered and applied?
It's true that 4 weeks ago, we were very afraid of the possibility of the virus spreading very quickly in asylum centers, especially due to the promiscuity in those buildings. The fact is that it didn't happen. The fact is that the authorities have taken the measures they estimated appropriate at that time, and I would say that now the situation seems not different than the situation in the rest of the country for the rest of the population, which is a good thing. Hopefully it hasn't been in another way, which would have been possible. But the fact is that, I mean, this is not the priority problem at this stage.
So you think it was pretty well managed? The particular situation for the asylum seeker is okay, and there is enough space also in Switzerland, right?
Well, it also coincided with a period with lower levels of asylum requests, so that some centers have been reopened in order to be able to get enough distance to respect the criteria. And yeah, I will not judge the policy. I would just say that hopefully things seems to turn in the good direction.
Do you know anything about the new demands for asylum at the borders? Have there been any? Has any asylum seeker, has he been able to come in the country, or what's the situation since the last month?
There are still asylum requests. The levels are much lower than before. There are people who were actually already in the country and who were not yet registered as asylum seekers who have now registered. There are also certainly entries from outside, but again, the numbers are rather small. And I would say that really the priorities today, including for Switzerland, are not in the country, but especially in Greece, in Libya, and in the different hotspots that we have mentioned.
Mrs. Triggs, all these testimonies show that very probably, even if the flow has not come to zero, it has slowed down really. So does this mean that there are many more people than usually that are that suffer of human rights violation in the places where they live now and where normally they would have fled?
Yes, I think that's almost certainly true. And if we perhaps understand that overwhelmingly countries have either closed their borders completely or partially. Some permit, particularly if I may say so in Europe, do permit asylum procedures to go forward. Some countries are quite creatively using technology to allow registration of their asylum claims electronically, interviews being conducted in the same way we're discussing now. So there is an attempt in good faith by many countries to keep the processes going. But the fact remains that probably in the areas where the greatest need arises are countries in which there's an absolute blockage on the ability to move across borders. Clearly, of course, on the US-Mexican border, borders in North Central America, the Americas, and of course from North Africa across into Europe, and then from the east. So that is our dominant concern, that people who are, as a matter of fundamental international law, entitled to make a claim, are unable to do so in most jurisdictions. But there are important exceptions, and I have to acknowledge that. But particularly in North Africa and in parts of Central America, that simply isn't happening, and people are really in destitute circumstances, not directly because of COVID. In other words, just to repeat my point, COVID-19 itself is not the key problem. But it's been the driver, if you like. It's been what has created a discriminatory impact and led to probably the greatest threats to the international human rights regime, and particularly regime protecting refugee rights, that we've seen in 70 years. And that's the challenge, and that is why I'm very pleased to acknowledge that over 2/3 of European countries are, while exercising their right to protect their borders and to protect national health, they must do that. They are also allowing access to the asylum processes. And if I could pick up on Carolyn's point, the key principles in relation to maritime law, established not just in the lifetime of UNHCR, but for centuries, is the right to bring those rescued at sea to a safe port. And that is something that I think we need to drive these points home. It's not an unreasonable position. Of course you can protect in ports, of course you have quarantine and identity checks and so on, but it is possible to both protect public health, to manage ports in a proportionate, necessary way, and to ensure that you're allowing disembarkation. And perhaps I could finish by saying that, again, looking for a ray of light, as Mr. Biquet has been doing, the major countries, Germany, France, Spain, Italy, have written particularly to the Commission to ask for search and rescue solidarity mechanisms to ensure that safe ports are identified, mechanisms are in place with support to establish proper asylum systems in ways that are safe, and then to relocate those who have asylum claims. For those who do not have proper asylum claims, then alternative mechanisms can be looked at, even return where safe to do so. What I'm saying then is that there are some leadership positions being taken within the European Union and systems which could lead us to a way to resolve, because, as I said before, summer is coming, and we need to get the Commission Pact on Asylum resolved, and we need a solidarity mechanism for rescue at sea and determination of safe ports.
This shows actually that Europeans, since the beginning of this crisis, seems to be very weak, unable to take decisions, even for implementing the right to rescue at sea. Is there a real European problem today coming up with this crisis?
I think it's always easy to target the European Union as being incoherent and not able to set up a proper asylum system. But I think this has to be put in a broader picture. The broader picture is that as we have witnessed during the 2015-2016 arrivals, the number of people who at world level are able to travel long distance are higher than 50 years ago or even 20 years ago. This is a fact. So this means that it's quite difficult actually for the rather small number of countries who do have a real asylum policy to implement a system which has a certain level of credibility toward their own citizens. That's a real problem. I mean, this is not only an issue of populists using that for their own sake. It's also a real necessity to send a message which is understandable for the populations regarding who has to be welcomed, who will stay in the countries, who will not stay in the country, and what are the strategic priorities of the asylum system. And I must say that this is also the responsibilities of the UNHCR, IOM, but also of smaller NGOs to have perhaps a bit clearer message about what is the strategic plan for selecting, because the selection has to be made, people who will be long-term migrants and those who will not. And actually this is completely fuzzy, and this is absolutely ununderstandable for the European audience. And as soon as we have this situation, I'm sorry not to be very optimistic, but we will not see any improvement in the asylum system in Europe.
Mrs. Triggs, do you want to just answer to this point that Mr. Piguet talked about, Europe expecting, in a way, if I understand, to have a better directions for the policy they should apply, and this direction could be given by the UNHCR and other international organizations like our International Organization for Migration, for example, but UNHCR?
Well, look, I think they're fair questions. Firstly, I think the whole point of the Global Compact has been burden sharing, and countries like Malta need to be supported. Other massive refugee asylum seeker hosting countries, Turkey, obviously, with 4 million people that it's hosted for 9 years, extraordinary level of support and community supported, I might add. Colombia with 1.5 million, and so on. One could go on, but enormous burdens falling on a few countries, and sadly often countries least able to bear that burden. So I think we have to advocate more strongly than ever for the notion of responsibility and burden sharing. Now, I think Mr. Piguet makes the point, and I do agree. Messaging must be clear. If you're going to bring communities, people with you in a realistic political environment, the message must be clear. And that is why we want to be very clear at UNHCR through our advocacy, through the work of the High Commissioner, speaking, as I must say, regularly with prime ministers, with senior members of the Commission and Parliament, making the argument that is very well received, that asylum seekers and refugees have very particular rights, and those rights must be protected. Refugees are not migrants. And that is not always easy for people to understand. And I think I can learn myself in my position, one has to be clear about the message, and we will continue to work on that message. But I think advocacy, and if I may say so, to put the question back a little, political leadership is needed to be able to express these needs very clearly to the community, to the public. That's an important part.
Just in one word, if I may, are you telling us that actually, like the UN in general, you just can do what the members want and you have no own decision-making possibilities?
Oh, I'm an international lawyer by background. Of course, we are a member-driven organization. We are dependent on our members. However, there's no doubt at all that UNHCR has I think, and we must be modest and humble about this, because we are a member, we are dependent on member states, but at the same time, we have an authority and a credibility and a reputation, I hope, for operational work on the ground, as well as advocacy for these normative principles that it's my job to promote. So yes, I think we do have a role, and I quite accept Mr. Piguet's challenge. We have to be clearer in our messaging, and we have to be able to speak to those members of the community who are saying, what is going on here? We not only do we need to protect our borders for security reasons, but we need to do so in the context of at least for 100 years, an unprecedented threat to global health. So we must be clear about that.
Gianluca Rocco, what is your take for Greece in this complex political situation? Who should help Greece? Is Europe, in your sense, doing enough? And are you getting the funds you need to handle the situation in Greece today?
Yeah, let me go back for a minute to what Mr. Piguet said, because I think he made a very good point. You know, we have to start deciding, countries or the EU, we have to start discussing ourselves and deciding how do we want to manage migration. Asylum is a component of migration management. Border management is a component of migration management. Deportation is a component of migration management. All these elements are not making an impact if they are not tackled all together. We cannot focus on one of the elements and think that we can manage migration with border management by building walls. You don't manage migration with just one element. And this is what we have to advocate and push for. We have to decide as Europeans, as people of a national government, what do we want to do with migration? So let's bring this into the case of Greece that you were asking me. This cannot be decided only by Greece. The problem of the situation that we have at the border, at the Greek border, is that Europe didn't decide how to manage this type of migration. The messages have to be clear. Who is entitled to come? Refugees, of course. And on this one, I think that we are a bit more advanced as Europeans because we all agree in this. Then how we do it, then sometimes is disputable, but nobody disputes that the refugees should have a certain treatment in the EU. The problem comes when we start talking about labor migration. We need labor migration in Europe, at least in Italy, at least in Greece, with the aging of the population. We need to have serious policies also on this. So this is where we have to come through. This is not a money issue. It's a policy issue. We have to decide politically what we want to do. The money here in Greece, if you take the COVID-19, there are already investments from mainly the European Commissions in projects and activities in the field. So they gave us the opportunity to increase the budgets and to do more for COVID-19. Plus, the situation of Greece is a bit different because they get some funding through as a member state for COVID-19 that will also use for all populations. So again, it's not a money issue. It's to decide, all of us, as Europeans, what do we want to do on migration.
Thank you. Carolina Busada, you want to react to that, please?
Just to respond to what has been said before, I mean, I understand that legal statuses are important for the management of the claims, but before we can actually manage the asylum claims, people's lives must be saved. So even before we actually get into refugees are not migrants, migrants are not refugees, and labor work is important. I agree, but systems must be put in place. So death is not being used as a border management system. And at the moment, at least in the central Mediterranean area, there's a massive question mark on, are we really willing to save lives? I doubt, because we've been asking, and to answer Mr. Piguet's comments, we've been very, very clear on the request on Europe for the central Mediterranean. We've been asking for a European system of search and rescue for years now. We've been asking as well for a burden sharing and for a disembarkation mechanism that do not put the burden only on Malta and Italy. We've been asking as well for other European countries apart from Germany and France and recently Luxembourg and Ireland and Portugal to actually host people after disembarkation. So a disembarkation, a proactive disembarkation mechanism could be set in place. So those are things that need to be done very, very quickly in order to save people's lives. And I think for me, COVID or not COVID, that's probably the first step to do.
Thank you, Mr. Piguet. Can you react to that? Is Europe really has difficulties to answer to those questions, but could it do more, and how?
It has to be remembered that the numbers are not that high. I mean, this is important. We are not at all flooded with people who are trying to come to Europe. This is absolutely not the case.
So we should be able to manage that.
So it would be perfectly possible to manage that. But again, as I mentioned before, there is a clear decision that has to be made before in order to implement even safe and rescue action cannot be implemented if there is not a message regarding what happens to the people who are disembarked. Even if it is legally binding to disembark people, some politician might always find a way to prevent that if the people are not convinced that it is a necessity, at least to welcome the people for a procedural analysis of their case, and that maybe they will not be allowed to stay if they are not recognized as refugee. This message has to be sent before. And again, just for an optimistic note, it has been possible in the past. I mean, the conditions were completely different geopolitically, but the comprehensive plan of action for Indo-Chinese refugees in the 1970s, so hundreds of thousands of people drowning in the sea. So many people who were packed in camps around Vietnam. And it was nevertheless possible for the international community to set up a plan of relocation, which was successful, but which included also many people who had to return to Vietnam. So it was a package which was coherent and which succeeded. So it is possible.
Mrs. Triggs, why is it not possible today? I mean, at least why is it not the reality today?
Well, I think one is that the political environment in the globe today across the world is very different than it was in relation to Vietnam. There was a very clear understanding at that time, particularly by Western political leaders, including Australia, that if you take a particular side in the Vietnam Civil War, it's a logical conclusion you're going to have thousands upon thousands of refugees, and there was an acceptance that something had to be done about it, and it was. We're not in that political position today. Can I come back again to the point about how we get clear messages across to the public, to the communities that are asking perfectly sensible questions? And one aspect that is a weakness that I think we need to work on, and that is that those who are not refugees, and they've had a proper attempt or effort to have their claim assessed, but where they're not, then it does become important to consider returns. And returns have not, in fact, proved possible. And I quite take the point that some European Mediterranean states have taken disembarkations, found that people are not refugees under a proper due process, and then been unable to return them. Now, there are wider human rights concerns, family reunification, and so on. But I think as far as the public is concerned, they have a sense that, well, it doesn't really work, and that returns have not, in fact, been a practical reality. And I think that's something we need to work on, partly to strengthen the asylum refugee program. In other words, those that meet those standards should be given those rights. Just to come quickly to Caroline's point, yes, of course, she's quite right. First of all, we must rescue people. That is a preeminent position, and I think we have to start at the beginning on that, particularly in the Mediterranean area.
Thank you. Let's shortly go to the financing, to the funding of the aid that is needed today. And before coming back to Mrs. Triggs, I want to ask a very concrete question to Caroline Aboussada. Your organization it's a non-governmental organization, right? Yeah. I mean, your funding is not infinite, probably. And here with COVID-19, we see that there is and will be a lot of competition for the fundraising. And I guess that some NGOs will probably disappear because they are no more able to get their funds. What do you think about that? Is this a risk for the global situation too, that some NGOs can't work anymore? And can you tell us about exactly what's the position and what's the situation of your organization, SOS Méditerranée?
Well, for the global picture, definitely some NGOs will be in a very difficult situation because we've seen as well for our organization since the beginning of the crisis, the private funding part has decreased a lot. So because people are themselves in a very difficult socio-economic situation, they're not really willing to fund NGOs, regardless of the work they do, by the way. But even in Switzerland, I mean, like there's a part of the workforce that has gone on partial unemployment, and there is uncertainty on their economic future that also affects dramatically the funding part. For our side, the chance we have is that at least in Switzerland, we have a diverse spectrum of funding. So it's both, it's the private people, private donors giving us money. We also have foundations. We also have collectivities. So cities, some cantons are also helping us. So for the moment, we're okay. I mean, it really depends on our capacity as well to go back as soon as possible at sea, because we've seen that last year when we were looking for a ship, when we had to stop the charter of the Aquarius, we were out of the Mediterranean Sea for 5 to 6 months. And the funds dramatically decreased. So it's for sure our capacity to be operational is directly connected to the fundraising. But for sure, there's going to be, some smaller or less visible organizations are probably going to be wiped out of the scene because of the lack of funding.
Mrs. Triggs, you are in the directorate of a big organization, and you're trying to find funds also for COVID. And I just read in one of your press releases that you were able only to get 20% of what you needed in a certain situation linked to the COVID-19. Is there enough money today for treating the refugee questions, as everybody is asking for money for all kind of purposes, and the industrialized countries are funding their own help for their own people and their own industry? Is there still money left for refugees today?
Well, I think the answer is definitely there is money there. The Secretary General has launched a $2 billion appeal, which I understand is coming up to about halfway. But I should say more optimistically, UNHCR has been quite successful within that funding approach in achieving the funding that we're looking for, or at least close to it. We're doing quite well. I think something in the order of 60% or close to that for our funding. So, but I should say that in the next couple of weeks, a new funding revision is being made by the Secretary General to increase it again to respond to the COVID crisis, acknowledging that, of course, it's not, as I said earlier, a wholly health problem. It's an economic and social problem. It's sexual-based violence. It's aged people. It's children, and it's loss of livelihood for the breadwinner in a family that's led to all sorts of economic and social problems. So, but to come back to your question, yes, there is money there, but there is an underlying problem of competition, and that's not something that we want to engage in. We certainly don't want to prevent funds getting to others. That's not the aim at all. But the Secretary General does have this one single major fund in which all the agencies are putting in their necessary amounts. Can I come back just for a moment to the position of NGOs, because that is an important issue. We operate through them to a very high degree. The Secretary Secretary General has recognized that many NGOs will simply be unable to operate unless they get more funding. So part of the major Secretary General appeal includes and will increase the percentages to go to NGOs. So that's a recognized issue, and I think the United Nations is getting onto it.
Thank you. One more question for you, Mrs. Triggs, shortly. The WHO has to show that they are efficient so that they could have a chance to get back the US funding. Could you be also in this situation of having to prove that you are doing it, handle the things the right way? Is there any kind of risk that you could also lose a support of the United States, let's say, in this question?
Well, at the moment, we have the support of the United States. In fact, we have very significant support by the United States.
What's part of the budget from the United States?
The United States supports approximately 43% of UNHCR's budget. It is our most generous single donor, the second, of course, being the EU and Germany, but the United States is a very, very strong supporter. So we expect that level of support will continue, but it is absolutely vital to the work that we do.
Thank you. Let's perhaps.
Okay, can I just add? Sorry, there was one thing I should have answered the other part of your question. Of course, we are subject, as all UN agencies are, to the need to demonstrate that what we say we'll do, we will do. And as you may know, the Secretary General and our High Commissioner have insisted on stay and deliver. Now, we're definitely staying, but we're going to be judged as to how well we're delivering. And we are making sure that we will be evaluated. We have the data to demonstrate that we have delivered and that we've done the best we can with the funds we've got. Thank you very much.
So if I understand, there is no signal from the US that anything is going to happening with the UNHCR for the moment. Very good. Mr. Piguet, what's your take on that? You talked about Europe before and the way they can or could respond, and that they are doing not a too bad job, actually, if I understand. Do you think the UN system to fight this kind of crisis is still adapted to the situation today?
Well, I think the asylum international system is one of the most important conquests of the second part of the 20th century. And UNHCR has been doing extraordinary programs for a very, very long time. This has to be kept in mind. Even if there are some criticisms that might be addressed, it remains one of the few common task that the international community is doing on a continuous basis. And this being said, the difficulties are really huge, because there is a fundamental tension between the idea of helping refugees to find new countries or new places of safety and the nation state system. I mean, there is a fundamental contradiction there, and to overcome this contradiction is a very, very slow process. So I'm not saying that the European Union is doing a good job. That's not what I'm saying. I'm fairly critical, but I say that it's an extraordinarily difficult task, and it's to a certain extent a task which is rather new. I mean, 100 years ago, one started to care about refugees, but it's a very, very new thing. I mean, to overcome individual and state egoisms in that respect. So let's be modest.
Thank you. Before I go to the next question on the last part of our discussion, if in the Zoom audience there are some people who want to ask a question, please raise your hand and we will give you the floor. In the meantime, Gianluca Rocco, one more question. We have a hand, but I just finished with that. Gianluca Rocco, if you look forward, where will the situation be in let's say, 2 years in Greece, of the refugees in Greece. How do you see at that? And what will be the defining decision that can change this for the best, for sure?
Yeah, I would say that Greece situation, the refugee crisis in Greece and the whole migration crisis that is affecting Europe through Greece and Italy is it's a political issue. So this doesn't mean that everything is political, so we cannot solve anything. But here, the policy plays a major role. There is on one side the EU and on the other side Turkey. And there was a EU-Turkey statement. It's very interesting that the only political tool that we have to try to frame this crisis is a statement. It's not a legal act. It's not a political act. It's a statement with the strength that the statement has. So I think that in the future, either we find a way as Europe to decide what to do on this side of the border, or the situation is what we have seen for the past 2 years. Because no matter, let's say that Syria will pacify tomorrow morning and everything is fine, still we will have high inflows from Central Asia, from Iraq, from Afghanistan, of people that are coming here. African nationals are coming through Turkey into Europe via Greece. So this is not something that is related to a situation that might be solved tomorrow. This requires political willingness to decide what to do on migration in general on this side of the border.
Thank you very much. We get it. We have a question from Yu Yoshitake from the Asahi Shimbun. Please, the floor is yours.
Thank you. Can you hear me?
Yes, we can hear you.
Yes. About the mass infection case IOM has reported in the Porto Hedi. I'm a bit surprised because Greece is not the country which experienced massive infection like UK or France or any or some countries in Europe, and I know how IOM is operating the facilities. They have probably a high standard, but even that it happened. So what does it mean? That what measures can be taken, learning from that case, and not only in Greece, also in other parts of the world?
To whom do you address to your question?
Ms. Triggs and also Mr. Pierre.
Mr. Rocco.
Yeah.
Okay.
Yeah.
Mrs. Triggs?
If I understand the question, then is how is it even in strong health systems in relatively advanced countries, we are still having outbreaks of infection, and I think that is a question we will have to investigate in the longer term. It is very interesting that we've had such high rates of infection in some of the most sophisticated healthcare systems in the world, and very low in other parts of the world, partly for all sorts of reasons of contagion. But I think we will have to see to understand more why the infections have been so rampant in some parts and not others.
Gianluca Rocco, do you want to add something?
Yeah, just to briefly ask, because the issue goes to the problem that we all have in Europe. There is the testing. If we don't do the testing, then we don't know who is really positive or not. If the lady that had to deliver didn't go to the hospital, we will never figure out that we have 150 cases in the hotel because they're all asymptomatic, and after 20 days they're all fine. They don't require medical attention. So again, as Ms. Triggs said, is in Italy has spread in a region where we have the most developed health system in all Italy. So, you know, it's not related to the health system. It's related to, you know, migrant communities are like any other community. They get exposed to virus as all of us. If you know, if they get in touch with the person that is infected, then being asymptomatic is much more easy to have a high number of cases in one location.
Thank you. If there's no other question, I just would like to end up this discussion with a more general question, and please answer shortly, if you can, Mrs. Triggs. What will be the impact of COVID-19 on the long-run situation of refugees? Just have an idea. I know it's very difficult.
Well, that is, of course, a question where we are trying to get evidence in order to give you some kind of an accurate answer. The real impact, we think, is going to be social and economic, and predominantly economic. In other words, we have a long way to go. We are looking at food shortages, food insecurity, projected starvation for millions upon millions of people. We haven't been able to discuss it today, but the tragedy is that people of concern, people in vulnerable situations, not only refugees and asylum seekers, migrants, many, many millions across the world, tend to, at the bottom of the pyramid, to be in informal employment if they have employment. But they're the first to go. They are already the ones, we already know this, they are the ones that are most vulnerable. And so we think that with those economic consequences and attending phenomena of rising domestic violence, we think that we're going to have population movements that will reflect those concerns. And we also have the curious situation in which in some countries, refugees and asylum seekers are leaving, but others are coming back. There are movements in ways that we've not really seen before. So we've seen, for example, people going back from Pakistan to Afghanistan in very large numbers to a country that simply has no capacity to manage their health needs, and certainly not to provide employment or safety. So this is a highly volatile and unpredictable environment. But the short answer to the question is we see it as predominantly economic, with enormous psychosocial consequences for the community. And we fear a lost generation of 1.5 billion children not able to attend school. So the consequences are well beyond health, although the health at the moment, of course, the deaths are horrific. But we're going to see much bigger impacts over the next few years. Thank you.
Thank you. Caroline Abusada, your take on this long-term effect?
Yeah, definitely. I mean, the problem is that what it's creating elsewhere that will trigger, that probably more people on the move for at least a short period of time. So it's not a predictive science. So it's extremely difficult at the moment to know, but it's not going to get any better anytime soon, probably.
Thank you. And to end this discussion, I will ask the same question to Etienne Piguet, perhaps more on the political side. Is there a chance that in, let's say, 2-3 years, the policy will be more clear for Europe or the world policy even? Let's dream a little bit.
No, I fear that in the short and medium term, the consequences will be really that there will be a rise in nationalistic tendencies, and it's only on the longer term that I see some possible hope, in the sense that the virus, in a sense, shows that we are one human species. It's very banal to say, but it might be a kind of warning message that wise future politicians might take into account to see that there is no other way as a multilateral cooperation. But that's a long-term project. And in that sense, it might be finally a good thing for humanity.
Thank you, Maria. That's a very good conclusion for this excellent discussion. I really want to thank you all, Mrs. Triggs from UNHCR, Caroline Abusada from SOS Méditerranée, Gianluca Rocco from International Organization for Migration, and Etienne Piguet professor at the University of Neuchâtel, expert in migration questions. Thank you really very much, and I will come back to you for to conclude this by mail. Thanks again, and have a good afternoon, and stay safe. Prenez soin de vous, as we say.
Thank you. Thank you.
Thank you.
Thank you.
Bye-bye. Thank you.
Bye.
Bye-bye, everybody. Thank you.